Welcome to the College of Health research seminar for fall semester 2023. I'm Marie Harvey, Associate Dean for Research in the college, and I'm delighted to see those of you here in the room and those of you coming in via Zoom. Thank you for joining us. I am also pleased to introduce Sunil Khanna, who is the Bob and Sarah Rothschild Endowed Chair for Global Health. He's also the director of the Global Health Program here in our college, and he is going to be introducing our colleagues who I'm pleased they were able to show up. They were having some travel difficulties, so I think Sunil will provide a bit of introduction, but I'm delighted and you're all in for a treat.
Thank you, Marie, for the introduction, and welcome everybody to our Friday seminar series. So it is really my pleasure to introduce the speakers for today's presentation. I have known both Nancy and David for a very long time, and I'm so glad that they found their way up here to Oregon. Nancy is a professor in the Department of Anthropology at the University of South Florida, and she earned her MA in Linguistics and Anthropology and a PhD in Anthropology from SUNY Buffalo. And her research interest includes health inequalities, food security, HIV/AIDS, reproductive health, and the health of the underserved communities. Our co-speaker with Nancy today is Dr. David Himmelgreen, and he's a professor in the Department of Anthropology and the director of the Advancement of Food Security and Healthy Communities at the University of South Florida. He earned his MA and PhD in anthropology from SUNY Buffalo. I think that's where both of them met. And his research areas include food security, growth and development, human health inequalities, and HIV/AIDS. And just recently, David was recognized as a fellow of the American Association of the Advancement of Science. So we are very, very happy that both of them are here. For those of you who are joining us via Zoom, if you have questions, please put those questions in the QA part of your Zoom, and we will be monitoring that section here, and we will be reading your questions out loud so that everybody here in the room can hear your questions, and David and Nancy can respond to those. So please join me in welcoming David and Nancy.
So good afternoon, everyone. Thank you for your kind invitation. I want to thank Dr. Harvey, Dr. Khanna, and the rest of the faculty who asked us to be here today. So what we want to talk about is a university food bank partnership. And I'll talk a little bit about the history of that. There aren't too many in the United States that I'm aware of, and this is something that was kind of in the planning stages for quite a few years, and ultimately resulted in the establishment of the Center for the Advancement of Food Security and Healthy Communities. So I think I'm going to start with some background information on food insecurity, and then talk a little bit about the center, and then Nancy's going to talk about 3 examples of projects that we've done. So if you can go to the next slide, please. So I want to talk a little bit about food insecurity and hunger in the U.S. This is an area that I've worked in for the last 25 or 30 years. I think since the pandemic, it really has gotten a lot more, the whole issue of hunger and food insecurity has gotten a lot more visibility in the U.S. And I can't tell you how many students are reaching out to me now and who are interested in this topic. So let's start with some definitions. There are a bunch of definitions on what food insecurity is. One of the ones I like is the social condition of limited or uncertain access to adequate food. and when a person is food insecure. A person is food insecure when they lack regular access to enough safe and nutritious food for normal growth and development and an active, healthy life. And one of the things that is really interesting to me is, this idea that there's food insecurity and there's hunger. So I want to give you a definition of hunger. It is a feeling of discomfort. It's a physiological condition, a sensation resulting from the lack of food. But one of the things that I've seen in the literature and in my own experience is a lot of people talk about hunger. It pulls on our heartstrings. But hunger, food insecurity occurs with or without hunger. And if you look at the US, yes, there is some absolute hunger, and that is a shame, considering that we're such a food-rich country. But the larger issue is food insecurity. The access of, again, to a nutritious diet and the consumption of an energy-dense diet that is not very rich nutritionally. I think that's the bigger problem that we're seeing in the US. So when I talk to food banks, again, they emphasize hunger, but a lot of the problems they're actually seeing is the quality of diet. It's a huge problem. So the USDA has these food security categories. There is an annual measurement of food insecurity done across the US. And if you look, it ranges from high food security to very low food security. So starting with marginal food insecurity, there is issues around anxiety and concern about running out of food or not having enough money to buy food. But the quantity and the quality of diet and the variety is really not substantially affected based on this scale. With low food security, we have reduced quality, variety, and desirability of food in the household. And then very low food security is actually, we see some hunger where people are either not eating, skipping meals, or eating less. So again, when we look at these food security categories that are measured annually, really the bigger issue is around quality, variety, and not so much quantity or not eating at all. Next slide. So there are 4 requirements to be food secure, and this has been helpful to me in thinking about research and program evaluation. There's the issue of availability. There's a reliable source and consistent source of quality food. But often, even if there's availability, people don't have access to it. They don't have sufficient resources to produce and or purchase the food. And that's a lot of the food insecurity that we're seeing in Florida. Food is available, but people don't have the money. They don't have the transportation. They live in food deserts. They live in food swamps where there just is very limited or no availability of nutritious food. And then the third requirement is utilization. And this is something that we're coming up, we see a lot of too, is that people, do they have the knowledge and basic sanitary conditions to choose, prepare, and distribute food in a way that results in good nutrition? And sometimes they don't, sometimes they do. In my experience doing research over the years, often people know what to tell you when you ask about, eating a healthy diet. They know all the right things to say, but they're not always able to do that. And then there needs to be stability across these dimensions: availability, access, and utilization, in order for there to be food security. Next slide. So I'll talk about some of the barriers, risks, and food insecurity trends. So again, barriers include low income, high unemployment, inadequate access to affordable and nutritious food, limited transportation options, and we see this a lot in Florida. Public transportation is really poor. You have to have a car in Florida, and often people, if they don't have that, they're more likely to be food insecure. We also have issues of social isolation. We have a large elderly population in Florida, and especially in Tampa Bay, where we do a lot of our work. And often there's, this is a factor in being food insecure among the older adult population. Disability as well. High-risk groups include households with children, single-parent households, Alice households. And this is a term that was defined by the United Way some years ago. And it means asset limited, income constrained, but employed. And we're finding a very high level of Alice households in Florida and across the country. So there is a correlation, an association between being an Alice household and the likelihood of being food insecure. So these are often households where you have one or more people working. They own their own homes, they're renting, they're not houseless, but they're struggling to make ends meet. And one of the things we're seeing in our area in particular is the very high cost of housing. It's really gone up through the roof in the last 2 years. Also, a very significant increase in property taxes among people who own their homes. You all heard about hurricanes in Florida and other natural disasters. So that's really driven up the cost of homeowners insurance. One study by the United Way found that in Pinellas County, which is right across the bay from Hillsborough County, where our university is 42% of households are Alice households. Very significant number. Of course, minority and other vulnerable populations, and lastly, households below poverty line. So these are the high-risk groups that we're seeing. Here are some data on food insecurity trends. Tracking of food insecurity really dates back to the late 1990s, and we see the change over time. First, during the great economic or the Great Recession we had in 2008, 2009, the orange line is households with children, and the yellow line is all households. And we saw these peaks in food insecurity. For example, in 2009, 1 in 5 households with children were food insecure. Those levels came down, and then beginning in 2020, those levels started to go up. And this is the result of the pandemic and the economic fallout from the pandemic. And what we're finding is that the data and talking with the food banks and food pantries we work with, the demand is still there and it's increasing. And that's because of the high cost of food, inflation in general, cost of housing. So even though the economy is in pretty good shape, we have low unemployment, wages are still not keeping up with the cost of living. And at least in Florida, we're seeing much more need, and it's not, probably not going to come down anytime soon. And here is some data on food insecurity by race and ethnicity in the expected pattern you would expect, by race and ethnicity. And these are the trends from 2010 to 21. Again, minorities, other vulnerable populations are much more likely to be food insecure than the white population in general. Okay, so in the US, often food insecurity is associated with poor health outcomes, and I have some data on that. So a lot of what we're seeing, and it's not just us, but across the board, type 2 diabetes, hypertension, cardiovascular disease, kidney disease, and certain cancers. A lot of folks who are food insecure, or some of the household members are dealing with these health issues. And there is this mental health component too, and it really is this cyclical relationship. You see depression, anxiety, stress, substance abuse, eating disorders, PTSD, and that can result in food insecurity and vice versa, and then a higher risk of these physical health conditions. So again, some absolute hunger, some undernutrition, some growth stunting, but a very small percentage of the overall problems are related to those issues. Most of the health problems we're seeing are related to these often dietary related chronic diseases. Okay. So we do use some theory to guide the work we do at our center. And basically, this is a paper that we published in Social Science and Medicine a couple of years ago. And what we really look at the timing that food insecurity is occurring and the intensity. And depending on where in the life course someone is, the risks for food insecurity are much higher, and the risks for adverse health outcomes are much higher. You'll recognize these dimensions I mentioned before of food insecurity, availability, access, and utilization, stress. This leads to food instability, what we call in evolutionary biology and biological anthropology, these life history trade-offs that can affect the macro and micronutrient budget, leads to changes in nutritional status, immune function, and health, and this increased risk for these diet-related chronic diseases. And more recently, we started doing some research on microbiome and food insecurity. So we did a small study, and we're looking at the results now, comparing the gut microbiome of food insecure versus food insecure adults. And we should have the results for that very soon. So this is a kind of a life course approach that we're taking to a lot of the work we do. Okay, so a little bit about the center now. This is, as I said before, a partnership between University of South Florida, the center that really was established just in 2020, and Feeding Tampa Bay. Next slide. So a little bit about our history of the center. I've been working with Feeding Tampa Bay since 2013 and 14. And I think one of the most important things we did was in 15, 16, we developed this MOU between USF and Feeding Tampa Bay to work together on addressing food insecurity in Tampa Bay. And we're talking about 3 to 4 million people if we take into account all the counties that Feeding Tampa Bay covers. So it's a large population, a very diverse population. It includes urban centers like Tampa, a major city, St. Petersburg, but also some very rural counties. So we see food insecurity, rural, peri-urban, and urban. So in 2020, the center opened up, and our Board of Governors, which oversees the university system, recognized the center as a statewide center in 2021. And this was really important as well, because we're beginning to do more work with organizations outside of the Tampa Bay area. And we're also, we did some work for Feeding America National in 2021. So Feeding Tampa Bay covers 10 counties in West Central Florida, okay, including the Tampa Bay area. In 2022, they served or provided 92 million meals, but the actual need is probably 130 to 140 million meals. And they don't see that going down anytime soon, even though we're kind of moving out of the COVID phase because of all the economic issues that are going on. One of the other things about Feeding Tampa Bay is it's not just a food bank. They really take this holistic view of food insecurity as a social determinant, among other social determinant of diseases. And they do other things like job training, work with clinics and hospitals on food as medicine programs, and health clinics. They just raised $58 million, and they're building a new facility, which will be the largest social services provider in the Tampa Bay area. It's scheduled to open in February 2024. And one of the things they do is they're going to have multiple classrooms and conference centers for other community-based organizations to go to the food bank and work on projects, collaborate on projects with each other and with the food bank. So our mission is to transform the conversation about food insecurity using research, education, and transformational programs to facilitate social equity that results in healthier communities. So we very much see the connection between food security and health and this notion of social equity. We're anthropologists. We're very interested and committed to social justice. And we realize that the inequities in our system and existing inequality contribute to this problem that we're seeing. So we have 4 goals. Mostly what we do now is research on food insecurity and health, program evaluation. We've done a lot of projects and we're getting a lot of requests to do more projects. We raise awareness about food insecurity and the fact that it's affecting a wide range of folks, not just people who don't have homes, but again, people at poverty, below poverty, but even middle income folks. We work on developing action plans and policy statements. And one of the things I'm most proud about is that we are training this next generation of researchers and advocates. So since before the center from 2015-16, when we signed our MOU, we've, I think, trained about 35 students, mostly graduate students, but some undergraduates. And about 75% of those students have been funded, so either through graduate assistantships or research assistantships. So they get the funding plus tuition waivers. It's really important, as we all know, students do struggle to get through their programs. Next slide. So 20 plus projects since 2016 with community partners, 34 students employed. We have most of our funding comes through grants and contracts. And the interesting thing that we were telling your dean this morning is increasingly we're getting funding from health insurance providers who are interested in reducing food insecurity. I think they see it as a bottom line issue, cost savings. It's much less expensive to ensure that people are food secure rather than them get sick, show up at the ER, or have to go on high cost meds. So Humana and Florida Blue Cross Blue Shield and other health insurance providers are providing funding for us, and pretty much hands off. I mean, we submit proposals and we do the research and they don't interfere with all, at least in our experience, they don't interfere at all with the research. A number of students have been funded, their theses and dissertations have been funded, and we have an undergraduate internship program, and we're actually formalizing that with our honors college at USF. Next slide. So these are some examples of projects we've done in the past. Just mentioned 2 of them. Teen Food Insecurity, which was done in Pinellas County in Florida. This was actually funded by the Juvenile Welfare Board of Pinellas County. And we did a really interesting study on food insecurity among high school students. And we used a methodology called photo voice. And basically we gave the student prompts. What does it mean to be food insecure? What does it look like in your home and neighborhood? And how do you manage food insecurity? They take photos. We then had focus groups, and they created this exhibit. And then we gave a community presentation on that data plus other data collected as part of this project. And it was really powerful because the people in the audience included educators, some politicians, and the community at large. And that actually led to some changes in the high schools in terms of the school policy regarding lunches in the classroom. In the past, kids who weren't eligible for free or reduced lunch, if they didn't have any money or couldn't purchase lunch or they couldn't bring their lunch, they would get a cheese sandwich, basically. And there was all the stigma associated with that. After this study, the county changed its policy and the kids now get a standardized lunch. Kids talk a lot about stigma being food insecure. Why don't we move on to the next slide? Okay. Yep. So I think Nancy's going to take over now and talk about 3 different projects. Some of them are ongoing and some of them have been completed.
Yep. Okay. So David mentioned some of the projects, he just listed some of them. We have done several research projects, evaluation projects. And I'm just going to talk about 3 of them. So I don't know how much people here know about food as medicine programs. Food as medicine are also known as food prescription programs, food as medicine, or food is medicine, which is the term that Feeding America is using right now. So food as medicine are relatively new in terms of an approach that really looks at the importance of food security as really the basics for the management of chronic diseases, diet-related chronic diseases such as type 2 diabetes, cardiovascular disease, and hypertension. So the idea is that these are done in clinical settings. So people come into patients who present with any of these conditions are actually screened for food insecurity. If they are found to be food insecure, they are referred, they are enrolled in the program. And the program that we evaluated was with 2 clinics run by Ivara, which is Ivara Health, 2 clinics in one of the adjacent counties to ours. They enrolled, so they would do that. They enrolled 330 patients in the food RX program. And what they did is that people who were participating in the program were given vouchers for $25 to redeem for fresh fruits, like fruits and vegetables at the clinic. The really interesting part is that Feeding Tampa Bay provided the resources and Humana. This was actually one of the programs funded by Humana, the insurance company. We were able, or they were able, to actually build a pantry in the clinic, at the 2 clinics. So people would go for their checkups or to see the doctors. They would be given their vouchers and they would go immediately to redeem their voucher. They could also have the opportunity to go to a mobile, like a truck that you saw in another picture from Feeding Tampa Bay that goes to different neighborhoods. So those were the 2 ways of redeeming vouchers. So we did the evaluation, and what we wanted to do here is to look at the impact of the program, not only on the physical health and the management of these chronic diseases, but also more holistically on social and emotional well-being. This was important because this was done during COVID. So that was and that also posed tons and tons of logistical issues in terms of conducting the research and the evaluation. So the 330 participants in the program, we were able to enroll 204 in the evaluation part. And we did kind of longitudinal data collection at intake, 3 months, 6 months, and then at the end of the program, 12 months. Of course, there was attrition because people had lots of problems with that, but we were able to get really, really solid data. We did surveys, systematic observations, interviews, but we also had data, biomarker data from the clinic, so especially at intake and at different points. So we had data, for example, about blood pressure. We had HbA1c, which is of course a marker of how well you're managing your type 2 diabetes. We had data on weight. Oh, and that's a picture of the actual products that we had at the pantries at the clinic, for example. And what we found is that we looked at the frequency of food redemption, how often people actually were able to redeem those $25 vouchers, was really associated with improved outcomes. And we also found that a lot of people were not redeeming because there are structural issues, right? Lack of transportation, or they were working. A lot of people were working and were not able to go to the clinic, or they saw the doctor and they had to go get their kids from daycare, whatever. So they had lots and lots of time constraints, or they could not go, during the times that the mobile pantry was there. So a lot of issues of transportation were present. But we found out that the more people redeemed, the better able they were to manage their chronic diseases. We saw improvements in food security status. So if you remember the graph that David showed about the different levels of food security, we may have, for example, people who at intake had very low food security, we saw an improvement to the next category. So we saw really significant, there were statistically significant improvements. We saw reduction on HbA1c, which was really, really important because type 2 diabetes, of course, is associated with lots of other diseases and other complications. So reduction in blood pressure, a small reduction in weight and BMI, and some of the things that people say, I was so happy that, I lost 10 pounds because for the first time I have the ability to eat healthy food, right? Or, my glucose, my sugar went from, and somebody told us, literally cut down, and my A1C went down, to half of what it was because I had access to the food that I need. Important, very reduction in stress levels. Of course, food insecurity causes a lot of stress, and especially during COVID. So we saw really important reductions in stress level and very high client satisfaction. People love these. They love the fact that it was a good supplement for, they will tell us, food is very expensive at the supermarket. We know that we have to eat healthy. We just don't have the means for doing that. They love the variety. They love the fact that they were able to choose their own. There's a client-based client choice model. They were able to choose their own food. They did have some recommendations, and that was really great. One of the things that we like, this was the first year of the program that we did the evaluation. One of the recommendations, one of the barriers is that, as I said, transportation, and participants suggested home delivery. The second year, they actually implemented home delivery, and we did the evaluation of that. It wasn't too good. Because then with food delivery, you don't have the choice, client choice. And because you're dependent on transportation and leaving the box of food outside the door, if people are there or not, then the type of foods that you can provide are different, right? So less fresh fruit and vegetables. There were some, but, it was different. So we did the evaluation of the second one, but this is really, really important. And food as medicine is becoming very important. And there's really not much research on how good, what works and what doesn't. So I think that, we're doing some good research on that. Now I'm going to tell you about my favorite program. This was a very small program. It's called Where Love Grows. And it's run by a small nonprofit organization. And what they want to do is they want to fight hunger in two ways. They provide hot meals for families. They have every week, they have hot meals. They have distribution of food at schools and all that. But importantly, they do have cooking lessons for kids. So the idea is that teaching kids how to cook has an impact on their nutrition. So we did the evaluation of this program. Could you go back for a second? One of the things, and this is really important because this is all the things we did, focus groups with parents, staff, volunteers. We attempted to do a photo voice. And if we have time, we'll tell you why we attempted. We failed, but we attempted to do it. But pre and post test, the agency actually had collected their own pre and post test, and they asked us to look at that. And one of the things that we found out is that they didn't really have the ability, or it wasn't collected the right way. So what I like about this project is that we were also able to provide some type of, what do you call that? Like skill training and developing some instruments that were used in later on. But I'll tell you. So we did focus groups with parents and all that. And this I love because obviously the parents, we said, what do you think about, what was your experience with the kids, doing this program? And they said, it's great that they learn about nutrition, about food and all that, but there are so many other things that they learn. They said, for example, when they have to measure, they apply their math skills, especially if they have to measure to cook for the whole family, then they have to multiply. So, math skills. Reading, because they are given the recipes. They, especially for little kids, they said they practice their reading. They pay a lot of attention to detail. The other thing is they learn how to communicate with others, with other children. These are all pictures from their program. So you see the kids, communicating with others. There's a lot of collaboration. So parents were saying, I see changes in my kids, the way that they communicate with others. One that I love, they said the self-esteem and the pride that they show that is so evident when they do something that is so, is their product. So I love these pictures, for example, and these are parents told us that. Next one. Parents also say, we love the fact that especially for boys, for preteens and teens, this gives them something to do to keep them out of trouble. And so that's a picture of 3 boys the boys loved it. I mean, boys and girls, all of them loved it. And they also said, in addition to that, they learned skills that could be useful, helpful in the future. And I was just, in preparing this, I was just going back to, we did this evaluation in 2019. In preparing this, I looked at their website again. They are now supporting, culinary school for kids who want to go to that. So that's amazing to me. They also said, the relationship between siblings is much, much better. They don't bicker so much, they collaborate, especially when they go through the program together. So these are 2 kids who have gone together. And they also say, in addition, kids are teaching parents or grandparents how to cook, and that creates that additional bond among different generations. This is just, this is not their picture, but I put it there to demonstrate that. So I thought, that's what I love, that program, because it shows that it's much, much, much more than just providing food, right? And the next one, this one is one that we're doing right now. This is it's called the 15th Street Farm Nutrition Education Program. And these were partnering with an urban garden called the 15th Street Farm in St. Petersburg, which is about 45 minutes from Tampa. This is funded by USDA and NIFA. And what we are doing, the whole idea is to teach little kids. We're working with different schools right now. We have 4 schools. We have another, I don't know, like 3 or 4 that we're gonna be working with. These are schools from kindergarten all the way to middle school. And the idea is to teach kids not only about nutrition, but also about gardening. And the idea is to show this connection between healthy soil, healthy plants, and healthy communities. There is also, so the kids are involved, very much involved in gardening skills, and they taste different things that they had never tasted before. And also part of this program is the creation or renovation of gardens that are already in schools to try to continue this once the program is finished. So for the evaluation of this, we're doing a lot of systematic observations. And for all of these, there are students involved, right? We looked at the curriculum that was used, and a lot of revamping and a lot of technical assistance in creating that too. We interviews with trainers, teachers, administrators, parents, age-appropriate data collections. So we could see a little girl, doing drawings. So depending on the age of the kids, we use different methods. We have had media coverage for that. This is a really nice journal issue.
Yeah, this is geared for teenagers who are interested in STEM as well as educators. It's based out of the UK, so they did a really nice article about the program.
So the link is there, if anybody wants to see it. And then finally, this is a video about the program and the evaluation that we're doing.
Okay, you got it. Very good.
What'd you get?
I got squash. Some people are really scared of bees, but bees help your plants grow because they pollinate.
You see how this looks a little bit like the broccoli? Okay. So try these.
Tell me again what that is.
It's a cuckoo melon. are actually really good.
So that's it. I know I ran through that, but I know we wanted to leave some time for questions and answers, but that's just a sample of some of the things that we've been doing. So I don't know if you have questions.
You want to take them here first?
Any folks? Questions, comments?
Yes, well, this is great. Thank you so much. You probably know that we also have garden gardens, school gardens that work on this. Yeah, I had so many thoughts as you were going through this. What can we really learn given the work that we're doing in Oregon? One of the things that I don't know that we've measured, particularly with the Veggie RX, you call it food for medicine. We have a Veggie RX, same kind of a thing here. Whether or not having access, because it's easily available and it's paid for, starts to change people's patterns when they go shopping on their own.
I don't think yes, we got a little bit of that. What we found is that people were saying, I really, before this, I never even thought about the importance of diet and my diabetes or my hypertension, but now I'm motivated. But it was more the idea, recognizing that they had the knowledge. And I think that's what's really important, because we always hear that, people are not compliant and they're not, the lifestyle, making the lifestyle changes that they need to make, right, quote unquote. But what this shows is that people do have the knowledge. They know they have to eat well, but they said it's so expensive when I go to the supermarket and a cucumber is like, I don't know, $1.25, and here I can buy it for 35 cents, right? So yes, they did that, but they also still had the barrier. So they learn and say, yeah, I'm gonna shop better, but still the economic barrier was very, very clear. But they said, I'm motivated to, they also said they go out less, they go to fast food restaurants less, because now at least they have all the ingredients that they may need to make a healthy meal, right? So less fried foods, less fast foods. But yeah, the motivation and the knowledge, and they love the recipes. The program also provides recipes, nutrition information. They love that. And especially one of the things that we're interested in that we measure also in the second year of the program was the issue of food waste, because we don't know, what people do with things that they don't recognize, that they don't know, or foods that they don't like. And that is one of the problems when, you get these donations and people are given, say like a box of food, and they go through that and there are things they don't like, or they don't even know how to prepare. So the issue of how to prepare new things was dealt with, through recipes that the program provided. But the second year, we were very interested in, figuring out what happens with things that they don't like.
Yeah. I can give two examples too of that as well. So we did a couple of other projects. One was with a Boys and Girls Club, and they had this weekend food backpack program. So we wanted to find out, this was before the pandemic, what happened to the food. So the kids, these were mostly preteens, teens, would get a box, a backpack of food. So we wanted to find out what happened to the food, who they shared it with, and what happened, with it, if all the food was used. And in that study, we found there were certain food items that, and this was mostly kids who were living in a rural area of the county whose parents were migrant laborers working in agriculture. So some of the foods like canned chicken salad, they never ate it. So they just discarded it. And they asked for other types of foods. A lot of them were from Central America, so they wanted more culturally appropriate, meaningful foods. And then we also did a study with a food clinic in St. Petersburg a few years later, again, and this is what we actually did household visits. And the same sort of thing came up where some people discarded food or gave it away because they either were not familiar with it or they didn't know how to prepare it. And the classic example from this study was eggplants. A lot of people didn't know what to do with eggplant. And what we did is at the clinic connected them with other people who used the clinic who knew how to prepare eggplant. And they started sharing information about eggplant preparation. So this issue of socially acceptable food, culturally appropriate food, is a really important issue that the food bank is beginning to pay more attention to.
Hi, Allison Myers. Thanks for being here. I think there are measures too, right, that are coming out on acceptability as one of these A's. Maybe you could talk a little bit about that. And then I would be remiss if I didn't say that there are lots of us in our college and extension around the state of Oregon doing this work. So hopefully there's a lot of us on Zoom listening in, or that there's a recording to share, because a lot of us will see ourselves, I think, in you and the gardening and the nutrition education and working really towards food security rather than simple access or nutrition, things like that.
Yeah, no, that's great. And it would be great to share, information about our respective projects. And we're always open to collaboration too. And we love coming to visit here. We've been to Oregon. So any reason to get away from the high heat of Florida in the summer is always a prime motivator for us. And one thing I didn't know until Dr. Khanna mentioned to us is that there is, in the state of Oregon, there's a high rate of food insecurity, especially in rural areas. And I didn't know that. In the American Southeast in particular, we see very high rates, this is why you can't always think about politics either, because it doesn't cut across, it cuts across political divides as well. So I think we do have a lot to share. And the first part of your first comment about these measures and Feeding America, and I'm actually reading a dissertation now from a student who did a study of food policies and how they're implemented at food banks, and how they're received and their acceptability. And so the chapter I just finished on the way here was kind of looking at the different ways to go beyond just measuring the number of pounds of food that are given out, but actually looking at food quality issues. And the point of her study is actually to, again, it's not just jam this down people's throats, but is it acceptable? If we're going to have these targets like foods to encourage, it'd be 70%. Is that going to work in a particular clinic or group of clinics? So yeah, there's a lot going on, but I think a lot more that needs to be done in terms of research on measurement.
Okay, you mentioned that we're getting a lot of inquiries about collaboration on new projects. Building on the work you presented today, what next steps or upcoming work are you really excited about?
So that's a great question. And Okay, great. So thank you for that question. I think what's happening, at least in our area, is a lot of organizations, ones that are involved in food relief and even others that aren't directly involved, are reaching out to us in terms of grant writing, program evaluation, collaborative projects. Often, as you all know, they don't have the capacity to do this. I mean, they have, their budgets are small, and they are in the business mostly of providing food, but they know that they need data and they need to go beyond just the provision of food. So we are getting a lot of requests from these organizations to do these sorts of things. And we're collaborating a lot more with Feeding Tampa Bay, our main partner, on grants. So we just submitted a grant to FRAC and to look at after-school food programs and why a lot of them are underutilized. So we're very much, engaged in this kind of community engaged research and program development. And so a lot of the funding is through these grants and even more contracts now. But our capacity to take on too much more is always challenging. And that's why we're looking to raise some funds to grow the center. But it's really an important issue. And we're getting a lot more, again, people reaching out to us for, because we have some of the technical expertise that they're looking for.
I was going to follow up on that in that. Do you know, right? I was going to ask who loves money.
Yes.
We are doing it.
Are you?
Yeah, because so just last week, we were like working like crazy, trying to finish that grant for the evaluation to see why child nutrition programs are not being used, after school and and comparing rural versus urban areas. But we are doing it basically. David and I, our students. So we really need, to get funds to be able to hire, for example, a person who help with grant writing, because that's a lot of work.
Yeah, and I would add that like our food bank has grant writers on staff,
right,
but they're not necessarily trained in research methodology.
Yeah,
so they help a lot with, for example, providing the data on the sites, the settings, the kinds of work that they do, but the actual research program evaluation piece, they don't have that expertise.
Yeah, designing the research, the evaluation, creating protocols and the tools, all that falls into it.
So this might be related. I'm thinking about where the partners are and the incentives. You mentioned that there are health insurance providers who care about outcomes so that they're more likely to participate if they know that there's a program that will improve or decrease the utilization of the healthcare system. You may not know that our Medicaid managed care system in our state is evidence-based. And so it is pushing those Medicaid providers to make sure that they're having outcomes. So knowing that the large number of Medicaid eligibles in Florida, I won't talk about how many are actually recipients because all sorts of problems with getting people enrolled. Has there been any conversation down there about using the Medicaid system to think about how it could be involved in encouraging the use of these kinds of food for medicine programs, or what role might they have there?
I'm not aware of it. And I think part of the problem that you alluded to is, the state government has chosen not to take advantage of all of the, Medicaid and all of the federal, programs in place. But I will say that again, they're like Florida Blue Cross Blue Shield, they're actually, and Humana, which is actually based out of Lexington, Kentucky, they've been providing a lot of funding in Florida and other states for these kinds of initiatives. These food as medicine programs, food health as health programs. Even some of the hospitals are getting into the act. And we were mentioning this to your dean this morning, because he had mentioned that insurance providers might be a good source of support. Our experience has been a good one so far, even beyond the more traditional funding sources. Humana has been amazing. I mean, a lot of these programs that we're doing either studies of or program evaluations, they provided good sources of funding. I mean, not sometimes hundreds of thousands. The food as medicine program Nancy spoke about, I think they funded that at $600,000. A lot of it went for the food, but there was a healthy chunk of it that went for the program evaluation.
But there's no discussion about how Medicaid could be used. No, that's like the politics of Florida don't allow for that, unfortunately.
More questions?
Just have a comment. Maybe it's a question. I am
pleased to see how you are combining the research mission with the education mission of academia, and also with the outreach mission. So if you come to capture all three and having my own, I'm watching you train students as well. Did you have any wise counsel about how to do that?
Yeah.
So, I think
I think we can both answer this. So the center was established in 2020, and we had a whole series of workshops and events to raise awareness, and that often involves students. So we had a symposium on Black food matters too, and we brought in some scholars who work on food sovereignty and food security in the African American community. That was well attended. We've had a couple panels on, and this is a big issue, I think, here as well as across universities and at USF, college student food insecurity. We actually have data, really good data from USF. About 46% of our students, based on the 2021 study we did, are food insecure. So that raising public awareness is really critically important. And maybe you could talk a little bit about the training of students.
Yeah, I think, for me, the training of students is one of the most important things. As David says, one of the part of the mission of the center is to train the next generation of people who are interested in this type of research and intervention and evaluation. So we tried in every single project, we involve students. We involve them, and as much as possible, we try to get money for them, because I think, ethically, that's the right thing to do. And we involve students from, undergraduate level to PhD level. I think, and we just posted for the senior, we're doing a senior evaluation of a food as medicine program as senior among seniors. And we posted, for an internship for one position. We got probably 50, 60 applications from undergrads. The sad part is for that, we can only offer it for credit because we don't have the resources. So I think ethically, I would love to see us get money so that we can pay the students. They get a lot of experience. We always include our students in publications, because it's super important in presentations, publications. That means a lot to them, especially, MA and PhD students. If they have, our paper that was published in Social Science and Medicine, I think has three students, three of our grad students. For us, we're full professors. It doesn't make that much of a difference, but for them, it's super important.
You're often first authors.
Yeah.
So
yeah.
They take the lead on a project and write the paper, they'll be lead authors. Also, with the funding piece of it, the food bank is, they provide occasional funding for theses and dissertations.
Yeah.
So we had one of my MA students did a really interesting study on food insecurity and age of menarche in teenage girls. And the results were really interesting. That was funded by Feeding Tampa Bay.
Yeah.
I have a doctoral student defending next week who did a study on student veterans and community reintegration and food security. That was funded by the food bank. So creating these partnerships opens up doors for funding, and it further solidifies the relationship between the city and the food bank.
Yeah, I mean, when we have events like one that we're supposed to have in December, highlighting the work that we do, our students are asked to talk, and we highlight the work that they have done, because they contribute a lot. So yeah, but we're doing internships. Like I'm coordinating the internship for 2 undergrad students who are involved in the garden project, and then one of them is getting paid and gets internship credit, and she's actually writing her honors thesis with me based on that project. So many different ways, but definitely training of students, but also funding them would be really, really important. I think it's unethical to have internships without payment, especially for undergrad students who need so much. But sometimes we cannot we don't have any ways of paying them.
Well, please join me in thanking David and Nancy for wonderful, informative, and very inspiring. So thank you so much.
for having us.
Thank you for joining us.